Are you looking for ways to better communicate with your patients? In this video, we're going to go through 5 body language tips and tricks to ensure that you're communicating your message clearly.
For more body language and communication that you can use in the dental practice, make sure to subscribe to our channel, The Dental MVP, and don't forget to hit the bell so that you never miss out.
Did you know that the people you're trying to influence are actually subconsciously evaluating your trustworthiness and your credibility, not based solely on just what you say, but also what your body is communicating to them? By the end of this video, we're going to give you 5 ways to ensure that your body language is effectively communicating your message.
Studies have shown that effective nonverbal communication can actually way bump up your patient ratings and create more of a confidence as you as a provider. With that, they adhere to the treatment and you get better patient outcomes.
Tip number 1. I know this is one that you probably hear all the time, but ensure that you make good eye contact. Studies show that when we make eye contact, the neurotransmitter oxytocin is released, which really elicits that calming sense of belonging.
Tip number 2, remove your face mask and show your face. And don't forget to smile.
A study that was completed by the Boston Medical Center showed that a patient's level of perceived empathy that their provider had decreased when their providers wore their face masks, which in turn also reduced their desire for the continuity of care.
So don't forget to remove your face mask when you're going to have a conversation, or else you might be missing out on an entire connection point.
Tip number 3, make sure to show your hands. This is a really great opportunity to be able to build trust with your patients.
The next time someone new walks into the practice, I want you to pay attention to something. Where do you look when someone new approaches you? I bet you're thinking it's the eyes or the mouth, aren't you? Guess what? We actually look at the hands first, always. This is something that has been engraved in our brains way back when. Think of the caveman days, and someone is coming at you. You're going to look at their hands first. Are they a friend, or do they have a club and they're coming at you? Same thing with a stranger who's entering a building. You're always going to look at their hands first. This is part of your flight or fight response. You're looking to see, what is my next step? And then you look at their eyes or their mouth. So start paying attention to this. We want to know where those hands are at all times. It's very important for us.
Yes, it's this interesting phenomenon that happens in dentistry. So when we're in, whether it's dental school, hygiene school, assisting, we're taught that the best thing to do ergonomically is to keep our arms at our side, really kind of minimize how far out they are, keep your hands in an easy range to be able to access the mouth. We then put gloves on, and most of the time our hands are in a patient's mouth or they're grabbing other dental materials to prep for an appointment. And so we start to lose that ability to utilize our hands to help tell a story when we're seeing our patients.
It's so true. Think of when you were a little kid, or think of a child that you might even know right now. If you were to ask them a story, how extravagant do those hands get, right?
Mm-hmm.
They don't have the little robotic hands like we do in dentistry. They're all over the place telling these stories about these giants and everything like that that are bigger than them. And their hands go crazy. We lose that as we grow into adults. Naturally, we refine things. In dentistry, we refine things even more.
A little extreme.
A little
Definitely.
bit too much. So pay attention to your team members and see where their hands are. One thing that you're going to notice is a lot of times we have our hands behind our backs. Sketchy. Someone is approaching you and their hands are behind the back. This is going to create that uneasy feeling for your patient. Gloves on our hands already just shows that we don't see the hands that much. So take those gloves off when you're having conversations. Start showing your hands more to your patients and you're going to get much better outcomes. Tip number 4, pay attention to your own body positioning. Make sure you're on your patient's level.
Imagine how many times your patients come in and they're like, oh, I remember the last time that I came in, I was lectured about brushing and flossing, and I know I need this or I need that. A lot of times it's not necessarily what was said at those appointments, but it comes down to body language as well. Naturally, with the way that operatories are set up, we tend to fall into being in a higher position than our patients. So they may be sitting in the chair and we're sitting above them, or we're standing at the end of the chair and we're standing above them. This really gives that authority feeling where we are lecturing them. So imagine when you're reprimanding a child and you may stand and look down at them. That is the perception that our patients are getting. So it is tremendously important that we ensure that we sit them up to where we're on the same level when we're having a conversation. If we're standing, it's okay for them to be standing as well. If they're sitting, take a seat with them. Definitely pause any hygiene treatment, or if you need to have a big conversation, sit them up and have that conversation face to face with them so they feel like they really are involved with it and equals with you.
Tip number 5, pay attention to your feet. Yes, your feet. Did you know that even if you're fully engaged with your patient in a conversation, your body language is telling one story, your voice is telling a story? Well, guess what else could be telling another story? Your feet could be. If I'm engaged in a conversation with you and my feet are pointed towards the door, I'm saying I want out of this conversation. Your patients will pick up on this. Your team members will pick up on this. Pay attention to where your feet are pointed and make sure that every single part of you is engaged from head to toe.
Now that you've seen these 5 tips and tricks, we would love to know how they work for you in the office. Go ahead and pick one of these body language tips and apply it for a week. Leave in the comments how this may have changed your interactions with your patients or your colleagues.
We also want to know, is there someone in your practice who may be more liked by patients and team members? Are they following these 5 tips and tricks? Maybe it's even just naturally. Leave us a comment below so that we know how these individuals are interacting with their patients and if this is working for them as well. Know someone who could use this? Share the video with them. And hopefully you liked this video and it was useful for you. Do not forget to like our video and subscribe to the channel, The Dental MVP, so you never miss out on more tips and tricks from us.